You want to use a little ball?
Yeah.
All right. So the next topic is going to be about chest pain. So what is chest pain that is concerning for a cardiologist? So chest pain here. Yeah, that's the one that you want to use. See? What is this one?
I'm a widow.
Little what?
Widow ball.
Little basketball.
Little basketball.
So what is chest pain that is concerning? What is chest pain that is concerning for a cardiologist? Chest pain here, pain that moves to the shoulder, pain that is worse with stress, such as walking up a flight of stairs, going on a hike, or sometimes even with stress. Pain that's also better with rest or a medication called nitroglycerin. That medication is going to dilate the arteries, leading to the pain to subside. When we see that, we definitely want you to be seen by a cardiologist or your medical provider as soon as possible. If it's getting really bad or if it's brand new, ideally you want to go to a urgent care or emergency department. Typically an emergency department, because if you go to the urgent care 9 times out of 10 or even 10 times out of 10, they're going to recommend for you to go to an ER. So pain here, worse with exertion, better with rest, or a medication called nitroglycerin. So what can we do when you have that pain? Certain things include stress tests. If your symptoms have subsided by the time that you're in the hospital, we can even do an echocardiogram, an ultrasound of the heart. It lets us know how well the heart is squeezing. If the heart is squeezing abnormally, then the next step is going to be a cardiac catheterization. This is going to be looking for blockages. Those blockages we can open up with a stent. Sometimes you may have significant blockage or blockage in a scary location. These ones need open heart surgery. Coronary artery bypass graft, also known as cabbage. 1 second, let me go school this little girl.
I'm done.
Ooh. Too far. Don't go too far. Show him how you shoot it. No, dunk the ball. Dunk it. This is a dunk. Look. Ooh. Ooh, your turn. Ooh. Ooh, let's go. Clap. One of the things that we also have to realize is that not all chest pain is going to be due to cardiac chest pain. So you can have pancreatitis, cholecystitis, GERD or reflux, inflammation, pericarditis. All of these can cause chest pain. So if we've ruled out the scary symptoms of chest pain, cardiac pain, heart attacks, then we got to look at these non-scarier ones and also non-cardiac chest pain, meaning that we've ruled out everything. So following up with your medical provider, making sure that you don't have any rhythm issues. And then lastly, if we've ruled out everything, we gotta look at anxiety. And when we talk about anxiety, I don't want to not recognize that people get blamed. Unfortunately, women get blamed being told that they have anxiety. And it's unfair, it's inappropriate, and you just have to do your due diligence. Yes, there are people who fit a certain criteria who should not have heart disease, should not have a heart attack, but I've seen someone as young as 20, 22 years old have a heart attack. So typically I like to work people up significantly to make sure that their pain and their discomfort is not due to any type of blockage or heart failure or underlying heart issues. The history is going to tell me everything that I need to know. The history is really good in letting us know how aggressive we need to be. Now with all of this, to sum it all up, the most important thing is going to be to follow up with your medical provider on a routinely basis. You need to see them consistently if you're having some issues, if not at least once, twice a year, to make sure that not just heart failure, but things like high blood pressure, diabetes are all being treated appropriately. Because if you treat this early on and if you maintain it, you're preventing something like a heart attack, stroke from happening. And that's the main thing that we want to focus on. We want to focus on preventing heart disease from happening. We want to focus on preventing a stroke from happening, because there's just the downstream effects that can occur if it's not treated appropriately: recurring strokes, recurring heart attacks, and unfortunately passing away. So prevention is a lot better than treatment. It's Dr. Isang. If you got any benefit, leave a message, a comment, something.